Well, if you're using one of those popular weight loss / diabetes drugs, Wegovy or Ozempic, there's an important warning when it comes to your risk under anesthesia.
And the Fox Medical Team's Beth Galvin, she joins us live to talk about this morning. Beth, good morning. We know we're not supposed to eat or drink anything 6 to 8 hours before surgery. We hear that all the time because of the risk of aspiration. Explain what that is exactly.
So aspiration is when you breathe in into your lungs fluid or, food particles from your digestive tract. That can be an issue when you're under anesthesia or you're deeply sedated. You don't have that ability to sort of cough and clear your throat, and so food can sort of get backed up, and you can breathe in that, and it can get into the lungs. That happens. We see aspiration happen. It's pretty rare, maybe about once every 2,000 or 3,000 surgical cases, but it can be severe when it happens. It can cause pneumonias, it can cause, injury to the lungs. So it is something that anesthesiologists and surgeons are very aware of, and that's why they want you to, stop eating several hours, stop drinking water and fluid several hours before you have an operation.
Okay, so the concern is that the medication may raise that risk then when you're under anesthesia. So what is the guidance for anyone right now on Wegovy or Ozempic considering surgery? Do they stop taking the Wegovy or Ozempic?
So the issue seems to be that, because it slows down the digestive process, the food tends to stay, these medications, the food tends to stay in your stomach for longer. It takes you longer to digest. And so anecdotally, anesthesiologists are seeing evidence of people who follow all the directions that the surgeon says, they stop eating the day before, but they still have food content and they're aspirating that. It hasn't happened very often, but again, the risk is very serious there. So, what they're recommending, this is the American Society of Anesthesiologists came out with recommendations in the end of June and said, look, if you're on a daily medication of Wegovy or Ozempic, stop the day before your medication. Don't take it the day of your surgery, rather. If you're on a weekly injectable, stop the week before you have surgery to give your stomach a little bit more time to sort of speed up the digestion again. A Canadian anesthesiology group came out and said, no, we're seeing cases of people who've, taken a break for a week and they still have food in their stomach. So they're recommending you wait 3 weeks. You stop your medication, the injections of Wegovy 3 weeks before you're due to have a surgery.
3 weeks is a while. Is there any risk to stopping the medications for that long period of time?
There is risk. I mean, if you're taking the medications for type 2 diabetes, there's a risk, that might get out of balance. If you're taking it for weight loss, there is a risk that, you could regain some of the weight that you've lost by stopping the medication. So I think what's really important here is to talk to your doctor, talk to your surgeon about, hey, I am on this medication. What can we do to minimize any risk that I might have if I do need to be sedated or if I do need to go under general anesthesia.
Okay, Beth Galvin with our Fox Medical Team. Thanks as always. Important topic. A lot of people taking this medicine, so thank you.
Yeah, thank you.